imagine how much fun it is around here, particularly when we're dealing with mosquitoes. Okay, this is something that each and every one of you should be aware of. And with the amount of precipitation we had, those little critters are out there, and they are hungry, okay? And you don't want to become their lunch, and you want to be taking precautions. And Ms. Ritter, who do we have here? And then I'm going to connect directly with the commissioner. I'll let you introduce them.
Okay, so on the line we have Commissioner Encarnacion,
Right.
and I think she wants to do the honors of introducing.
Oh, she does. Does she know who's here?
Yes.
All right. Let's do it that way. Commissioner, a pleasant good morning to you, my dear, and a pleasant good evening to my listeners and to you as well when they rebroadcast this. How are you doing?
I'm well. How are you?
Well, I'm hanging in, you know. I'm kind of excited talking to you, and this is going to be an interesting topic, particularly with the precipitation we've had and the hunger out there amongst these little rascals to bite. Talk to me a little bit. Do you know who's your guest here today?
Well, I'm going to start, and then I'll just let Janessa continue. But first of all, I want to say thank you, not just for today, but you've actually been very open. You've been welcome into the Department of Health and our staff, and addressing a lot of the issues that we're faced with and that we are educating the public on. So for that, I say thank you.
You're welcome.
And
My
thank you
pleasure
for having
always.
us here today, as always. With us today, we have Dr. Brett Ellis, and Dr. Ellis oversees our laboratory within the Department of Health, and he can be more specific to you. He has a specialty, and I'll let you speak to him a little bit more about his specialty and his PhD and why it's so important for him to be involved in this project. And Kristen should be there as well with him, but I am going to Janessa. I'm going to let you take over and let us know who else is in the station with you.
All right. Well, listen, I know you're very busy. If you have time to monitor this, fine. If not, we clearly understand that you have other duties to do. But
I'm here. I'm here on the phone for a little bit. I am at the symposium for Medicare, which is very interesting. Is a very interesting discussion because it's something that each and every one of us will be impacted with, whether it be through friends, families, our loved ones. Medicaid is an issue also. You know that we're facing a Medicaid financial cliff if federal government doesn't sign into bill support for the U.S. territory. So that's something that we are dealing with. We ask your continued support.
Well, I can understand that. The governor was obviously up there to try to deal with this issue, and I think he was very wise to come back, even though this thing did not really affect us as much as we thought. But to be on the island was appropriate for him to be here. So
going back to that, you spoke a little bit earlier about the fact that we do have a lot of wetness throughout the territory.
Right.
And that, of course, breeds mosquitoes. We've been blessed. We have not seen vector-borne diseases for some time in terms of the numbers. But Brett and his team has now proposed a project that he's going to describe more clearly for you. What I would like for the listening audience to be able to take away from this is that it's an opportunity for us to be able to evaluate how we can better control some of we're not looking, if you think about it, not just that we're controlling mosquitoes, but we're also managing the diseases that actually affect the community. So that's one of the takeaways that I'd like the community to look at.
All right, go ahead.
I'd also like for you to take the opportunity to listen to the scientists that are here today to provide you more definition as to what the project is actually going to be about. Mm-hmm. So, Brett, I'm going to have you take over now, and Janessa, if you could continue, and I'll stay on the phone for a bit.
All right, we will continue then, Brett. Let's go to you by the numbers. Also, in the room, I want everybody to understand this is going to be like a workshop. If you feel there is something that you want to contribute to the discussion, please just kind of signal me one way or another, and I will acknowledge you. And what you should do is put your name out there again and who you are, even though I will probably do it in the context of our discussion, so everybody feel warm and fuzzy and comfortable.
I think
at this
we're all
point.
familiar with everyone here, but I'd like for you to kind of not just introduce yourself and your title, but tell the world what you do and what you contribute to the health department and our community, and what makes you important.
Doctor, go ahead.
All right. Holland, thanks for having me back. It's been a while. Thankfully, I haven't been back. You usually have me here to talk about mosquito issues. It's been relatively quiet here.
So many people have been.
At GaryJet MD, we do not just treat the pain symptoms. We treat the underlying problem causing the pain to give permanent relief.
All right, and we are back, and sorry, the computers are not talking to each other. Once in a while, we have that kind of issue. It was a technical difficulty, but I assure you this will be edited out, okay, tonight in the Community Access Channel. So, Dr. Britt Ellis, why don't you continue? Give us a little bit of your background. And, of course, you're always down here when these little critters are biting. Am I correct?
That's correct. Thankfully, I've not been here for quite some time because it has been...
well, we haven't missed you either, really. We don't like you coming in here and talking about bugs, all right?
Yeah. So it's been pretty quiet in terms of dengue and Zika and chikungunya, all those things that we know about. It's heated up elsewhere in the Caribbean and in Central America. But the Department of Health has been busy in the interim. And we're doing quite a bit of work.
So what do you do at the health department?
My actual position is the laboratory director.
Yes.
And we're setting up a public health laboratory to improve our care here on the islands. But the position I've had a long passion for and have worked on for probably close to 2 decades now has been mosquito-borne diseases, both here in the Virgin Islands, but also in Africa, in Hawaii, in Southeast Asia. And we all have this same problem because of this mosquito, that black and white one we always talk about, that Aedes aegypti mosquito.
All right, let me ask you a question. Of all of these, whether it's dengue, chikungunya, whatever, could you describe each one of those particular diseases, and what are the symptoms, or are they the same or one?
Yeah, they're all transmitted by that same mosquito, and they are similar in terms of having a febrile disease or frequently getting a rash, and so we have to do diagnostics to be able to differentiate them. Physicians sometimes can tell, or epidemiologists can tell by the type of symptoms. Fortunately, we have not had Zika for some time, and chikungunya for even longer, although there are still members of our community with after effects from chikungunya. You'll hear about people with arthritis and other issues that the Department of Health is still tracking.
So once you have a couple of these, you have them in your system, and then you can continue having a arthritis issue and stuff like that. Of all three, which is the one that you feel is most harmful?
I mean, if I was to contract one, the one that I would be most worried about would be chikungunya, just because of the really acute and strong effects it had on our population. Also, a third of our population caught chikungunya.
Oh my gosh!
I think you're a man, so I think the scariest one for me would be Zika.
Yeah, I was going to follow up. If I was speaking for my wife, it certainly would be Zika. And then I think the most challenging one is actually, while you had said once you get it once, you won't get it again. We have 4 dengues out there.
Oh,
so
my God.
4
So different
chances
varieties that could hit you. You think you might be immune to one and the other one you'll get, huh?
Yes, sir.
All right. Talk about the program that you've got a unique program, obviously, because I've done a little reading on it regarding the fact that it is the female of the species, whatever it is, the bug, that creates a lot of this havoc. But the males, you can, am I correct, either neuter the males or whatever, and you can create a situation where they self-destruct. Am I correct?
Yes, and actually, we do have a medical entomologist now with the Department of Health, so I can let her get into the details, and I'll introduce her in a second.
Sure.
But the Department of Health, we work on a lot of things for mosquito-borne diseases. It's not just this project that we're talking about today. We do a lot with education. It's our duty, and it's really important to us that our community is well informed about what the Department of Health is doing. We're still doing some work evaluating how well spraying works. We're testing new traps. We're monitoring mosquitoes, but I think the program that is most exciting is those are all old methods that we've had, but in recent years there are more innovative or novel methods, and one of these methods, while it's been around for a long time in agriculture, is the sterile insect technique. And I can let our entomologist get into more details, and I'd like to introduce her today. It's Crystal Seeger.
Crystal, go right ahead. Give us the glory detail on how we approach this issue. It's terribly interesting for me because we're actually using nature itself to obviously correct a problem. However, are there any side effects when you mess around with nature, creating something that's integrated into a program? But go ahead and speak on this.
Yeah, well, good day, everyone. Thank you for the introduction, Dr. Ellis, and to myself and to the vector control program we have at the Department of Health. So it is, as the entomologist for the Department of Health, it is my entire job to learn about the Aedes aegypti mosquito, the mosquito that can spread dengue, Zika, and chikungunya throughout our residents, and to try to figure out the best ways to control them. So this opportunity that we're here to talk about today, it's something called the sterile insect technique. It's something that has been around since the 1950s and first was used in agriculture to reduce agriculture pests. It was actually used on St. Croix in the 1970s.
Wow, interesting.
It was used to control the stable fly. The stable fly was a very awful pest to dairies and other farmers on the island, and the U.S. Department of Agriculture came down in the mid-1970s and released a lot of these sterile stable flies, and they did find a dramatic decrease in reduction of these stable flies. Now, for mosquito control, we can make these mosquitoes, as you said, neuter them in a slightly different way. And yes, it is using two things that already exist in nature in a strategic way to reduce the population. So the first of those is the Aedes aegypti mosquito itself. So most people don't realize that Aedes aegypti did not always used to be in the territory or even on this part of the world. The Aedes aegypti mosquito originated on the African continent and moved around the world as people moved, and it came to the Caribbean probably during the transatlantic slave trade 400 or 500 years ago. So that's when we became susceptible to getting these diseases from this mosquito. Also, the male mosquito does not bite. It cannot bite people.
Trust me, Holland made a joke about that already. But Crystal, I think it's important for our community to know what we're doing outside of this proposed project, because I think there's a lot that vector control is doing to control these mosquitoes. Can you guys talk a little bit about some of the other things that you do on a weekly basis with the vector control team?
Yeah, of course. So one of the biggest things that we do to learn about the Aedes aegypti mosquito here is we put out these traps to monitor the population and to learn about how the numbers of these of this mosquito changes throughout the year, seasonally. So we have a lot of traps out on St. Croix and St. Thomas, and we're working to put some traps out on St. John as well, so that we can learn about this mosquito. As Brett mentioned, we're also, as Dr. Ellis mentioned, we're also working on using a different type of trap that can reduce the population and seeing if how well it can work here in our environment. And also, we will in the future look at potentially a backpack spraying as a form of mosquito control and how well that works for our environment here as well.
Well, we can also ourselves try to modify our environment. I know you have made suggestions like tires that are sitting around and have water in them. I'm assuming the larvae come alive when there is moisture. Am I correct?
Yes. So mosquitoes need water to breed. The mosquito life cycle, you have the adults, and then the larvae, the pupae, and then those pupae become adults. So
Right.
the adults will lay their eggs in water bodies. And this Aedes aegypti mosquito in particular is very difficult to control because of where the adults lay the eggs. The adults like to lay the eggs in containers that we have created, that we have
Yeah.
around our homes.
Sure.
These small containers that are too small to have fish or too small to have other insects in them that would eat the mosquito larvae. You know, all it takes is a bottle cap turned upside down with some water in it, and you can have these Aedes aegypti mosquitoes in there.
Okay, let me ask you one thing. Let's slip back to, again, the program with, we call it neutering, whatever you want to do. How do you execute that program? Are you going to release a bunch of male mosquitoes that don't bite everybody out there, don't get nervous? Is that how
I
you
think
do
the
it?
first thing to say before you even explain the technique is that this is a proposed project.
Oh, okay, well, fine.
Yeah, so you know, that first piece of nature that we'll use in this sterile insect technique is the mosquito, and the second part is a naturally occurring bacteria called Wolbachia. So this bacteria called Wolbachia already exists in most insects all over the world, including bees and butterflies and dragonflies and even some mosquitoes. And it is not found in our Aedes aegypti mosquitoes here.
Okay.
But when you put this Wolbachia bacteria into these male non-biting Aedes aegypti mosquitoes, something really cool happens. So you can, when you would release these male mosquitoes with Wolbachia, and they would mate with these female mosquitoes we have without Wolbachia, all of those eggs that female mosquito lays will not hatch.
Right.
They cannot hatch. And if you think about it, every female mosquito can lay hundreds of eggs
Sure.
in her lifetime.
Right.
So for every time one of those male mosquitoes with Wolbachia mates
Mate.
with a female mosquito, that is hundreds of baby mosquitoes
Wow.
that will never hatch.
Wow.
That will never be born.
Now, how often does the male mate anyway? Can he mate with several females?
Yes, he
Okay.
can. Yes.
So they're very prolific.
Yeah.
Okay. All right, let's take a break at this point. We'll be back in a minute. We're on Caribbean Country 93.5. All right, and we are back again, and we're knee-deep in mosquitoes, and obviously this is a program that we're all concerned about, and each and every one of you out there ought to be listening to this. It will be on the Community Access Channel tonight, hopefully, and, of course, we are on Facebook, and you can catch us there, and we're going to rebroadcast it tonight. I was going to ask a couple of questions, which we did off the air. However, I want the folks to be entertained with the answer. We're talking about implementation, execution of the program, and Ritter did bring that up to me that it has not been approved yet. Talk to me about how that happens.
Sure. With any of these, tools we use for treating mosquitoes, they're regulated. Typically, in this case, for our chemicals, or for this novel approach with a biological, it's regulated by the EPA. And then DPNR, being our local regulatory for EPA,
Right.
they monitor, the amounts of, if we were spraying, how much spray we put out.
Sure.
Or if we ultimately release mosquitoes, and they'll monitor the number that are out and the locations and things like that. We also work closely with Department of Agriculture as well,
Sure.
Since they have a lot of experience from the agricultural side, but also with these kinds of pests.
Well, let me also say I'm assuming the mosquito is not on a time clock. They don't give a damn whether a program has been approved or disapproved. In the meantime, what do we do, and what advice do we give those out there that are listening to this broadcast to avoid catchment areas and issues like maybe spraying their screens with a bug repellent and putting that on. So in the meantime, what is your advice? Again, maybe Crystal, you can go into that area.
Yeah, certainly. So all those water sources that are around your home, like the bottoms of flower pots or even dog bowls with water, you can do your part by at least once a week dumping that water out. For the dog dish, at least once a week. That flower pot, dump that water out in the bottom at least once a week. Check around for, if you see rubbish lying around, pick it up so it doesn't become a breeding spot for
Yes.
these mosquitoes. Also, wearing mosquito repellent is a really good way to protect yourself, because
Yes.
even if you're able to do your part around your yard, removing those mosquito breeding areas, what about when you leave and when you're someplace else, right?
Sure.
Wear that mosquito repellent, and it's very important that these repellents are approved by the U.S. Environmental Protection Agency. So when you're buying a repellent and deciding which one to use, look at the label, and at the bottom of the label, you'll see in fine print this EPA number. If it has that EPA number, it means that it has been tested for safety and that it works.
All right. Let me ask you, with licensing and consumer affairs, should be there, is there mosquito in sprays that are here that are not meeting EPA requirements?
I'm not sure.
You're not sure.
I can't speak to that.
Yes.
But what I do know is when you are purchasing a repellent, you should look for that EPA
Yeah.
number at the bottom of the
Yeah,
label.
well, so many of us don't look at the fine line. It might be something you might want to discuss with, obviously, the commissioner working with licensing and consumer affairs. He's very aggressive on these things. Ritter, you had a question?
No, I was just going to say these things are regulated, but it could be that you're making your own mixture of some type
yeah,
of homemade
that's right.
repellent, for example. So
And during Zika, we did do a lot of inspections of areas and stores to make sure that they were selling.
Oh, you
ones.
did?
So
Okay.
we did.
Yeah, that's good.
We haven't recently, but this is the time of year where we start ramping up our work and our education to the communities. We typically, in the last few years, when we have had these initial cases of chikungunya or Zika, they've been at January, December, January, and then they pick up through the spring and the summer. So we are busy trying to get ready for this next year and getting these tools and everything ready, so we may have some other ways to combat mosquitoes.
What should our medical doctors be prepared for, and then how do they get back to you? Because the statistics are extremely critical, that you yourself know how many of these particular diseases are going around. So do you work closely with the medical profession?
Yeah, so the Department of Health does a really good job working closely with the hospitals and our medical providers. That is typically through our epidemiology division, and they frequently attend the grand rounds and will educate the doctors and the medical community. And our medical community is really educated, and they are the first responders
Right.
in terms of picking these up. And so they report those to the Department of Health.
Right, and there's no shots other than dealing with the symptom that is around to, again, make a patient less susceptible. Am I correct? I mean,
Yeah, there are things that physicians can do in terms of palliative care, but it's really important that they get picked up quick,
Right.
And that they are getting some treatment. There isn't a vaccine for these types of diseases at
That's what
this
I mean.
point.
Wow.
They are working on it. They are talking about potentially dengue vaccine being available after the start of the year. It's a different conversation, but yeah, it's really important that our physicians pick it up quick so that people can be monitored and treated.
well, it's interesting because it's worldwide, and you would think with the havoc that these diseases do cause, you would think that research would be working on those things,
Yeah, they're just challenging diseases.
because they're different strains, as you have said, right?
Yeah.
it's important to go to the doctor as well, because physicians can't report and track things, and our epidemiology team can't do what they do if you don't go to the doctor when you present those symptoms.
Yeah, and we maintain, low death rates for these because people do go to the doctor and they do get treatment. In other areas of the world where that's not the case, you
Right.
see much higher.
Well, without treatment, I'm assuming that if you let it progress, you can the bacteria that you can pick up. If you get a lung problem, you can also get pneumonia and stuff like that as a result of the first not taking care of yourself. Okay, right? Am I correct?
Yeah, and a lot of the challenges that come is from needing fluids and not staying well
Right.
hydrated, and they can take care of that.
Which we
with
do
an-
here historically, and I keep emphasizing to those that are listening, you really should be drinking a lot of water all the time, because you generally get on a drip system in the hospital and you get incapacitated and that kind of stuff, right?
Yep.
Any other points, again, that you think I should go over on this issue that you want to throw in?
Yeah, well, something else that to add to what you can do to, to help and protect yourself is also helping us. We have a lot of staff out in the field who will be setting these traps out.
Okay.
To learn about the mosquito and to make sure that the mosquito control methods we are trying are working. So you will see a lot of our project personnel out there going door to door, and they might happen to knock on your door and ask, "Hey, can we put one of these mosquito traps in your yard?" And
yes.
We would love it for you to say yes and help
sure.
us out. And a big concern that we've had too on social media is the mosquito's role in the food chain. So it's very important to note here that the mosquito that we are trying to control, it's only one type of mosquito
yes.
out of the, couple dozen types of different mosquitoes that live here. And the larvae of this Aedes aegypti mosquito, that I've mentioned before, they like to live in these small containers that are too small for fish or too small for other insects to live in and to breed off of. And a lot of people think, well, bats rely on the mosquitoes. Bats eat a lot of other different types of insects too. So by controlling this one type of mosquito, we're not that there's tons of other types of mosquitoes out there.
Right.
A couple dozen different types and lots of other insects. There's not a single animal that feeds only on mosquitoes or that feeds only on this type of mosquito.
I got you. All right. So as we go along, it's going to be interesting. As I say, the statistical data is available to you because you obviously, if it is implemented, you want to have an exit. Am I successful? Am I not? Should I do it differently? So on and so forth. Am I correct?
Yeah, I mean, one thing I would add is as well that that is helpful to the Department of Health is that the community does participate when
Yes.
we do outreach events, and they do ask questions. It is our responsibility to make sure people are well informed, and we will be reaching out. We will be having more events like this, and that people participate and ask questions.
Yes.
Is helpful for us.
I
Because
think we welcome the open discussion because this is something that is not brand new. And I know Crystal and Brett have lots of information, and the people that we're working with are also, experts on this stuff.
Yes.
So I think we really want to share that with the community to ease some of their concerns and just make sure that everyone's aware of what's happening and how they can help and how this affects us all.
Sure. Well, I like the suggestion. Don't sit there at home and know that you've got certain symptoms and you say, well, I can't go to the doctor or this or that because, this charity begins at home. We're talking about you out there, whether it's making sure your yard does not have a lot of standing water and, again,
Or
you're
junk.
using things like that, right? Right, and junk, whatever it is.
yeah, and there is a lot of information on the internet. Not all of it is always true. So it is helpful when we are alerted to some of those, stories that are going around so that we can address them. Not only for this program, but we did have that Eastern equine encephalitis that was on in the news. It's not a risk here. But those stories were going around that we were at risk, and it was helpful for us to be able to respond.
Also known as Triple E.
Okay.
So if you heard anything about that, you're not at risk if you're in the VI.
Okay, good. Knock on wood. We'll be back in a minute here on Caribbean Country. All right, and we are back again, and we're on Caribbean Country 93.5. Remember, by the number one, you can catch us on Facebook. You can see us now. And then we log it. You can pick it up at any time. We rebroadcast this tonight between 6 and 8. And Earl Morris is here from the Community Access Channel. And he had a very good question. I know we answered it off the air, but is there anything that we do for cisterns or any other standing water that we can put into the cistern to make it less attractive for these little critters to lay a larvae or have larvae in there?
Yeah, cisterns are particularly difficult to handle because it is people's source of water for their households.
Sure.
And although mosquitoes
You don't
can
want to
get
poison yourself. Okay, that's a good
exactly.
point. Yeah.
Exactly. And it can also be difficult to get into a cistern and even see if there are mosquitoes breeding in them. We have found that we do have Aedes aegypti mosquitoes breeding in about 40% of cisterns throughout the territory.
Right.
So the best thing you can do is just making sure those overflow pipes and those inputs are all screened with mesh that's fine enough to keep mosquitoes out. So that's the best thing to do right now, and we are starting to talk about and figure out other ways to control mosquitoes in your cistern. But it is a particularly difficult issue since it is people's source of household water.
All right, from left to right, let's do a recap. And out there, I encourage you to have a piece of paper or whatever, and I really mean this sincerely, write some notes down, because the recap is going to go over a lot of the discussion we had and the highlights. And we've got Dr. Brett Ellis here, who is the Territorial Laboratory Director. And if you would go by the numbers, the brief of the previous discussions we've had.
Sure. Again, I just wanted to highlight that the Department of Health has been very busy on mosquito-borne diseases, and that will be ramping up until the end of the year and into the next year, that's when we usually see our diseases. You'll see us out in the communities looking at the number of mosquitoes, and as we educate the community more or inform the community more about the kinds of work we're doing. And that being our traditional control with spraying, but also as we look and plan for the possibility of these innovative programs like we discussed, this sterile mosquito, sterile insect technique.
All right, Crystal, I think you're probably going to be talking more of the symptoms and the other issues that you and I went over, but I'm anxious to hear from you.
Yeah, so a brief recap is the sterile insect technique that we are proposing to use here on St. Croix has been used in other places successfully to control the Aedes aegypti mosquito, places like Fresno, California, and Singapore. It's also working right now in Houston. It's being used in Houston, Texas as well. If you have any questions about this, the sterile insect technique can get very confusing very quickly. You can please call us at 340-690-9177 or email us at dohvectorcontrol@usvi.onmicrosoft.com. Again, that hotline number is 340-690-9177, and the email is dohvectorcontrol@usvi.onmicrosoft.com.
Which one of you want to go over the symptoms again and how important it is to make sure you see your doctor?
Brett, so when you go over the symptoms, I got a lot of questions online about people wanting to come here. Oh, I'm pregnant or thinking about getting pregnant. Should I be concerned about Zika? And then I send them, news clippings from articles where Dr. Esther Ellis has, talked about Zika and how we haven't had a case in almost 2 years. So I think when you go over the symptoms, it's important to also note that we haven't had certain outbreaks in a while.
Yes, so certainly most of those questions I tend to direct towards the epidemiology division, but since there is ongoing dengue transmission on British Virgin Islands and Central America,
Sure.
It is good that people are alert to it. It's an acute febrile illness. You'll get a fever. You'll usually get a rash, and you'll have really achy joints. Those are the main symptoms we're looking at. You tend not to get cough and those that could be the flu. And so if you do have any of those symptoms, I know epidemiology division is actively looking for those cases if we do have any, so we can get ahead of those, that they do report that to their physician or to the Department of Health. So you can look for a fever, rash, achy joints, and typically without a cough.
It must be a lot of discomfort. Wow.
And we lab confirm cases.
Yeah, and so actually my main job is for the laboratory and for us to be able to respond quickly,
Yes.
both for mosquito-borne diseases and other public health. So we will do testing at the Department of Health, provided they have those symptoms, and the turnaround time's been improving, so you'll find out quick if you have it or not.
Wow, you must be considered an expert throughout the country with the experience you have. Wow. We're very fortunate to have you. Let's take a break at this point. We're going to continue this dialogue. All right, and we are back, and you're on Caribbean Country 93.5. And once again, we're on Facebook. It is recorded on the Community Access Channel. And please, anybody of your friends out there that you happen to be listening to this, that you think they should be exposed to this particular show, notify them. It'll be on tonight between 6 and 8. Now, this is the final hurrah. Whether I interrupted you rudely or there was something that you wanted to get off your chest, any one of you, including Ritter, obviously she is full of a lot of good questions, because we're going to wrap it up.
Well,
Yes.
I'm actually going to give this time to Brett and Crystal.
Okay.
I think they are eager to engage with the community and share more about this. This is just like one step of a very early phase of us doing some community education. La Shanette Shang, who's actually in the studio.
Yes.
She's just a tad shy. One of her primary roles.
I don't know why.
Oh, there we go.
Such a
Health
famous
Department.
family. I mean, my God, they're blue blood out there, okay?
Yeah, so one of her, I guess, primary roles at the health department is educating the community, and
And
she works
outreach.
She works really well with the Vector team. So we are pretty eager to continue what we do as far as outreach on other health topics, but something as important as
Sure.
vector control and what they do, we are really happy about that,
Yeah.
sharing that.
All right, guys, any closing thoughts? This is like a busman's holiday. I mean, you don't have to sit and talk to yourselves. Now you're talking to the entire Virgin Islands.
Yeah, so we very much want the community to be engaged and informed about what we're doing at the Department of Health for vector control.
Yes.
And, we do have, with this particular sterile insect project, we do have a lot of community outreach planned. So keep an eye out for announcements about community meetings. We'll post things on social media and issue press releases. So, keep your eyes and ears out for more information about that coming community outreach that will be happening.
All right, Doc, any other
Yeah,
things?
I will just echo the same. Please reach out to the Department of Health, and we'll be interacting with the community. And that, please follow up with us for information. And just to quell fears, this is a project we're talking about today is one we're planning. If we do go that route, it wouldn't be until next year. The Department of Health does not have GM mosquitoes and all of the stories that we've been seeing.
Sure.
Please contact us so we can get the right information out.
I'd like to add that
Sure,
in
please.
addition to what Brett and Crystal have said, and this is something that I deal with a lot. If you want accurate information about healthcare in the Virgin Islands, come to the Department of Health.
Sure.
We do a lot of outreach. We're on the radio. We're on your show
Yep.
at least a couple times a month.
Absolutely.
We post a lot on our website, on our Facebook page, especially because that's one way we can engage with the
Right.
community directly. So please come to us for official information. That's how you make sure that you have accurate info and not fake news. So
And this sterile insect technique can be very confusing because there are a lot of different ways
Sure.
to do it. And so when you're doing your own research, it might be confusing to know what we are proposing here as opposed to what's being done somewhere else.
but we'll be sure to outline what we're actually trying to do in the very near future in a way that's easy for everyone to understand.
Well, you're always welcome up here, and we
Thank you.
enjoy having you. And let me just say to everybody out there, you're the first line of defense on whether it's hurricane preparedness or dealing with other things in the community. What we try to do on this show is confuse you with the facts, okay? It's not a melee, chooping, teeth-sucking, whatever you want to call it show. It's based on facts, okay? There are going to be a lot of rumors going around, and, they're going to say, well, what is the Department of Health doing, yada, yada, yada. Now, we expose you so much, particularly with the Department of Health, because we feel it's that important. They're also extremely aggressive. They're no nonsense, and they have such a wide scope over our health in the Virgin Islands, whether it's mental health, whether it's our physical health, or so on. So to each and every one of you, I want to thank you for a very productive week that we had. I want to thank Daryl Joshin for being here, doing the postscript to the encounter we had with Karen, which fortunately we did pretty well with. So God bless each and every one of you. God bless the United States Virgin Islands. And, of course, God bless the greatest nation on this earth, the United States of America. See you next week.